Hi, everybody. Dr. Adam Baldowski here, introducing our interview with Dr. Elizabeth McMahon. This interview was a lot of fun for me personally. I'll speak for Jessica as well, saying that I'm sure it was fun for you. This interview was recorded end of last year, end of 2024. And unfortunately, Dr. McMahon passed away shortly after. In 2025.
She passed away actually last fall. I would
Oh,
have
was
to
it?
look
Oh,
up
okay.
exactly when it was. Yeah, and we had recorded obviously before that. And I'm so glad that wasn't she our first
She was. She
recording
was our very first
ever?
recording.
So yeah, so we're all a little bit rusty and clunky and all the things, and she was gracious and wonderful as she was. It's wonderful to have her voice recorded so that people will be able to hear it from her,
Mm-hmm.
from Elizabeth herself. And I want to highlight that if people want to look into, and I really advocate people doing so, looking into her work. She has so much out there. She has recorded trainings. She was really taking off with providing so much valuable information about using virtual reality, particularly with people who experience a variety of anxiety disorders and anxiety symptoms. Um, 3 books that we know of are already on her Amazon page and all of that. I know you and I have a couple of these. Overcoming Anxiety and Panic, which is an interactive guide. She has virtual reality therapy for anxiety. And then it looks like there is one that I didn't know about. So I'm going to look into it myself, which is digital delivery of mental health therapies. It's an edited book, and it looks like she has a chapter in that. And then, of course, I just happen to have. She has a fantastic chapter in the Hey, look, you have it too
Okay,
right there,
yeah.
in the MHVR book, and so we hope that you really can get a sense of Dr. McMahon, her amazing work in this field, and then have a lot of interest in looking into that further. And we just really want to honor her, thank her for coming on and speaking with us in the beginnings of this whole project. And she and her voice and her work will be very missed.
100%. So, everyone out there, enjoy this episode of MHVR Bites with Dr. Elizabeth McMahon. Welcome, everyone, to Reality Bites, the podcast where a couple of mental health techno professionals talk to other techno professionals about the exciting world of virtual reality therapy. My name is Adam Baldowski, licensed mental health counselor and media psychologist, and I will be your host today. And I'm joined by the amazing Jessica Stone, a licensed mental health professional and all-around great person, author. How are you, Jessica?
I'm good. I'm excited to be here. I'm excited to talk to Dr. McMahon.
I'm excited too. It's an exciting episode because we are going to be talking to author and consultant licensed psychologist, Dr. Elizabeth McMahon. Thank you for joining us today.
It's my pleasure. Thank you for inviting me.
So we got together and we're talking about this thing, virtual reality and therapy. And I know your name comes at kind of the top of the list of professionals who use this tool. Can you tell us a little bit about what is virtual reality and what is virtual reality therapy?
Well, virtual reality is when you put on some form of headset, which can be either extremely expensive or very inexpensive, and it blocks out your view of where you are and replaces it with a virtual environment, a virtual world. So wherever you look, you're inside this world that is created through either computer generated imagery or through VR video recording. and everything you hear fits that virtual reality. You're in another reality. Sometimes you have controllers so that you can move yourself around, sometimes not. There are optional additional equipment, but primarily it's you put on a headset and it transports you to a different world.
Cool. And how is that used in the therapeutic realm, especially when we're talking about mental health?
That is a really great question. So it can be used in a number of different ways. It can be used to help you achieve and deepen relaxation by transporting you to places that you would find deeply relaxing, whether that's beside a mountain stream or on a beautiful ocean beach with the waves, or uh, floating and seeing the universe, right? So it can help deepen relaxation. It can help you ground yourself when you're overwhelmed with emotion. It can help you learn and practice tools like diaphragmatic breathing to calm the body and the emotions, or progressive muscle relaxation, or mindfulness. But one of its most powerful tools is to, at least in mental health, is to help you do what's called exposure therapy, to help you face your fears in a safe, gradual way, controlled by your therapist who can be with you, you know, in your ear talking to you as you are guided through overcoming your fears and learning new tools. It can be life-changing. It is life-changing.
Mhm. One of the things I loved is as you were starting to talk about that, is you got a smile on your face, and it's it's I don't know why. I'll have to think about what the connection was, but it made me think of when we first met. We went to a conference in Denver, and we were on a panel together and talking about the different ways that we're we talk about and use virtual reality in mental health treatment, and there's a real kinship there for me between us, and then having your books. So I mean, one of them I even have right here next to me. So that's virtual reality therapy for anxiety, a guide for therapists, and then the other one, yeah, and then the other one, overcoming anxiety and panic, in the interactive guide. And I have that one as well, but it's at my office. I should have it right here with me, and I'm sorry. There it is. There it is. Um, and and so I guess where that tied together for me is the there are people out there who talk about anything in any field, and it feels like they're just talking about it. And then there are people who talk about it and it's deep for them. It's a passion. It has such meaning. And that's one of the things that I saw in that smile that came across your face and in your writings, is that passion that you have and the belief that you really have in this work. I wonder what, I don't know, me saying that to you, what that brings up.
Well, it warms my heart. And yes, I do have a passion for this because, it started out, and I read an article that said exposure, using virtual reality for exposure, is as effective as real life exposure. I'm like, what? Wait, what? You can do something in the office in a session that's as effective as the most effective treatment?
Mhm.
I totally want this. I've got to have this. And I started out using VR in 2010
Mhm.
when, it was expensive and clunky and incredibly effective.
Mhm.
And to see people overcome their fears, to see their lives expanded, there's nothing better. And VR helps that happen.
Mm-hmm. It's actually one of the things I had written down to possibly ask you. And so, of course, with sanitizing and all the things, even if it's an amalgamation would be fine. But do you have an example of your favorite experience?
I love treating fear of flying. Somebody calls me up with fear of flying and I'm like, yes, because if it's just simple fear of flying, I can almost guarantee that with using VR, they can be on the plane in 3 to 5 sessions.
Mm-hmm. That's
Uh,
amazing. It's life-changing.
it is life-changing. Let me tell you about say Joanne, not the real name, and I've changed. There's no identifying information here, but this is reflective of real clients I have treated. So Joanne came in to see me because she would not be able to sleep for days if she had to go on a flight. She had canceled flights. She had gotten off planes. She had gotten drunk and would sit there sobbing in the seat from terror. And she said, I can't go on like this. I've got to get over this fear. And I said, okay, great. Here's what we're going to do. We're going to teach you diaphragmatic breathing to help you just tolerate the anxiety response. We're going to talk together about what exactly are you afraid? Oh, well, the bump means the plane's going to go down. All right, so let me give you some facts about turbulence and how planes are designed and how they're built and how they're tested. And let's look at your fears and look at the facts so that you have an intellectual knowledge that what I'm asking you to do is not dangerous. But we all know intellectual knowledge is not the same as gut knowledge, right? So having prepared for VR, we then go and have the visceral experience of getting on the plane. And that's what VR offers, is you see the plane, you hear those sounds, you get a sense of the turbulence, and you do this in a gradual, repeated way. In VR, I can control how much turbulence the plane goes through. I can control where you sit. I can control what the weather is. And we can do takeoff over and over and over and over until takeoff doesn't scare you, until turbulence doesn't scare you.
Yeah.
That's what VR offers. She was back on the plane after 5 sessions.
Mm-hmm.
And traveling not only for business in the US, but traveling internationally for vacations, and sent me these, just thrilled emails with pictures of where she had gone.
Mm-hmm. When I was at VMed years ago, I was on a panel with Dr. Les Posen out of Australia, and that was the first time I had heard about using VR with fear of flying. And he was saying that in the past, he would actually charter a plane and take people up in the plane and try to work on the fear of flying with them in, a very expensive, time-consuming manner.
Exactly. And it can be, facing it in reality can be sometimes overwhelming.
Yes.
And then you end up with them more afraid.
And you can't, one of the things that's, I think, so wonderful about what you are doing with the virtual reality is that if it got to the point, they can take the headset off.
Exactly.
and you can work to re-regulate or whatever needs to happen. Whereas if you're actually up in a plane, that not much you can do except land, wait to actually land. And so I think a lot of people, not just with fear of flying, but some of the other exposure therapies and whatnot, I think a lot of people think, well, it's more convenient, it's less time, it's those kinds of things. But I think clinically, it's actually something that you can, as the therapist, and based on your knowledge, your expertise, what you know of the client, all of those pieces, bring it together to create an environment that is customized and manageable in a way that the actual, take the person up the elevator or in a plane, or, all those stereotypic examples we learned about, or have done in our careers. It's not just convenience. It's not just that. It's a different clinical experience.
The virtual experience feels real enough to trigger the anxiety response, right? Mm-hmm. But can be controlled by the therapist. So it's, as you say, you get graduated exposure. You get it individualized so that you maximize the chance of your client having success. Mm-hmm. Yeah. And we know that this is an evidence-based intervention. We know that research has shown that it evokes an emotional and a physical response. Mm-hmm. That what changes in the virtual world, those changes transfer to the real world. So it bridges this gap that we usually run into in therapy between talking about doing something and doing something in the real world. When you talk about it, you're not facing it, and your therapist is there to support you. If you have to do it alone in the real world, your therapist is not there, and there's no control over what happens. VR just makes this transition, mm-hmm. because in VR, your therapist is with you, but you're there on the plane or on the elevator or in this small space or speaking to the audience, and you gradually face your fears so that at each step of the way, you get to the point where you've changed what you're thinking and you've changed your emotional response, and you mm-hmm. face your fears step by step by step.
And it's a different neurological response and experience as well. I mean, the systems that are activated when we're speaking about it have differences from when we're imagining it or even drawing it or, some sort of creation. And it's different when you're in the headset and you're having all this sensory input that's telling your body you are in this environment and you're having this experience that's activating your mind and your perceptions and your ability to bring all of those experiences together to impact change in a completely different way.
Yes. That makes it a very powerful tool.
Absolutely. Yeah, that was the other thing I had written down about asking you. I think a lot in terms of immersion, embodiment, and psychological presence mm-hmm. with regards to virtual reality. And I was wondering how you saw those pieces coming into the work that you do.
Absolutely. That's the benefit of VR. It is immersive. Everything you see, everything you hear is part of this world, and you feel present. You literally feel on the plane, in the elevator, speaking to the group. The most common comment I have at the first time a client takes off the headset is, I didn't think it would be so real.
Mm-hmm.
And there, in a nutshell, you have the power and the potential benefit of VR.
I love it.
You know, hearing about these clients and this experience, I'm curious, what's the sixth session like when they come back in? Excuse me. When they come back in after having taken that flight, because I can see the smile on your face, and I know as clinicians, I think we can all relate. When we have that breakthrough with a client, there is kind of nothing like that feeling. What is it like for both you and the client in that follow-up session?
Sometimes we don't even need a follow-up session. Sometimes the follow-up is their text or their email to me. By the time we finish in VR, I've made it a point to have them face the worst situation that we can create in VR, which is often far more than anything that they would face in reality, right? Which gives them confidence. It lets both of us test, are the therapy tools working? And it is a tremendous, what's called relapse prevention tool, because if you've done in VR more than you would ever face in reality, then reality is a chip shot. Reality is easy. And in what's usually the last session, I make it a point of really testing. They're in VR, they're in the worst situation, and then I will say to them, make yourself as frightened as possible. We've gone over their fears, we've identified their fears. I'll say, okay, I will voice the fears. And I will say, I want you to make yourself as scared as possible. And I'll say on a 0 to 10 scale, which I've been using throughout therapy, where 0 is not afraid and 10 is really frightened, right? How scared can you make yourself? Go ahead, try and make yourself as scared as possible. And they'll say, okay, maybe a 3. Right? Great. Could you go into this situation with a 3? Could you talk, fly, go in the elevator, go in the crowds? And they'll say, oh yeah, okay. And now use your skills, bring it down. And they're like, okay, it's a 1. That lets both of us know, in the worst situation possible, when they're actively trying to make themselves afraid,
Mm-hmm.
there's not much fear left. And they use their tools, they can bring it down.
Mm-hmm. Yeah.
So,
And you've highlighted that for them. You've helped them through that process.
Yeah.
Highlighted it, helped them to highlight it, and then to realize it, and then they can trust it
Yes.
more.
Because I think the goal of therapy is not, let's teach you to relax so you never get anxious.
Mm-hmm.
I mean, if we controlled whether or not we got anxious, we would have a 2-second treatment. It would be, don't be anxious. Right?
Well, we'd also have other problems, right? Because anxiety is also our body's way of telling us something. There's also parts of that we need to pay attention to.
Exactly. And that's why looking at someone's fears, identifying them, and then evaluating to what degree are they realistic? Is the anxiety sending you what I think of as a true alarm and letting you know something that you need to listen to? Or is it sending a false alarm? Yeah.
something I'm curious about with all of this and working with the client, it's great when it works. What are the ethical implications of using VR in therapy? Like if a new clinician wanted to come in and start this, like you've talked about doing this since 2010, and there's this passion involved, but there's also, like we've discussed, sometimes people talk about things, they're knowledgeable of it, but there maybe isn't that passion. Like, what do new clinicians, or just clinicians in general who are interested in this, need to know, maybe from an ethical side, when using VR?
I think from an ethical side, the thing I emphasize, the thing to burn into your brain is VR is a tool, not a treatment. I mean, we talk about VR therapy, VR exposure therapy, but we're really using VR as a tool, and it's a wonderful tool, right? For all those things that I talked about: relaxing, calming, grounding, learning skills, changing your mood, overcoming fears, in graduated exposure. But just putting on a headset is not therapy. And getting a VR set doesn't suddenly make you an expert in anxiety or grounding or teaching those skills. So I would say, think about, as a therapist, think about what you're trained to treat, how VR as a tool can facilitate and support what you know what to do. And if you're excited about using it to overcome fears, make sure that you have been trained, or that you get training in doing exposure therapy.
I
And
love
and
that.
and I strongly feel, right, how important it is to not only make the facing fears gradual, but to be collaborative. Tell your client beforehand exactly what they're going to face in the virtual world, in the virtual environment. Don't just throw them in unprepared.
I love that. I love it's a tool, not a treatment, and that it's a collaborative experience. I think so often we
Yes.
forget that sometimes, that we get focused on the tools and think of them as treatment, and then sometimes forget that it is collaborative.
Right. Right. And personalized, right?
Mhm.
Adapted to your client, to their fears, to their experience.
Mhm.
That's what makes therapy so powerful and so wonderful.
And helps people to connect with the experience and the process in a bigger way. It's kind of like when we, I don't know, I'm sure most people have had the experience of going to some type of provider and being given the textbook answer, right? Like, oh, you have this, then do that, which can feel much less connecting than, but what are you experiencing? What's happening for you? What are your needs? What's standing out in that, and all of that? And then if the treatment or the whatever's on the other side is tailored to what that person is experiencing, there's a deeper connection, more follow through, higher success rate, all of those kinds of things that are going to come out of that. And I think that's one of the enormous powers of using virtual reality, is that as long as the therapist has done their due diligence and work to understand the client as much as they can,
Mm-hmm.
and they've done their due diligence to understand the tool,
Mm-hmm.
hardware and software.
Mm-hmm.
Hardware in terms of like settings and getting the person even acclimated to this thing on their head, and not being able to see outside of, I mean, I know we have better pass through now and whatnot than we did years ago, but so the hardware, and then of course the software, know what you're using with your client so you can pair it well with what their needs are,
Mm-hmm.
And then of course your theoretical foundation and all those skills and knowledge that you have that you're then bridging into this other set of tools. I think it's coming together, being ethical in all of those ways, doing all of the due diligence is really important on the therapist part, and then has that much more of a powerful impact on the client. What do you think about all of that? I just said a lot.
I agree with all of it. You should know your client. You should know the VR tool that you're going to use. Be familiar with the virtual environment before you put someone into it. Describe it, get permission, be collaborative, make sure that they, that they are prepared, that they have the tools, the anxiety management tools, the cognitive, what are called the cognitive tools. In other words, if I go into virtual reality and I'm thinking, oh my God, we're going to die, or I'm embarrassing myself in front of everyone, I can't do this, this is horrible, or there's not enough air to breathe in this enclosed space, then the virtual experience is going to be as bad as the real life experience.
Mm-hmm.
You need to understand with your client, how can they change what they're telling themselves. They, in therapist language, there has to be a cognitive change and a behavioral change, right? The person has to be able as to change what they're thinking, and at least on some level believe those new thoughts, believe those new facts, and they have to change what they do, right? If you say, oh, I know it's safe, but you don't go there, you avoid, or you leave when you get scared, or you do things to make yourself safe from a danger that doesn't exist, then you're not going to get over your fear. So changing how you act so that you're not doing actions based on fear,
Mm-hmm.
and understanding on some level that your fears are not supported, that this is a false alarm. And VR helps you do that, just in a very wonderful way. But yes, there has to be tools and understanding. There has to be a good, strong therapeutic alliance. You have to,
Mm-hmm.
as a client, you want to feel like you're heard and understood. You want to feel like you're respected and cared about. And you want to feel like there's a treatment plan that makes sense to you.
Mm-hmm.
And then you ought to see change.
Yeah.
Yeah.
You mentioned a couple of times the preparation process, like the importance of preparing your client, particularly for people who might be listening to this and are new to the idea, or maybe they've read about it but they haven't actually implemented it. They're new in the process in some way.
Mm-hmm.
Could you describe a bit of that preparation process for for everybody, but particularly for the people who are dipping their toe into this?
All right. If you're a client, then you could start with my client workbook.
Mm-hmm.
If you're dealing with fears, right? This book really takes you through looking at what are the various things that may be leading to this fear response that's
Mm-hmm.
causing you problems, and then steps you through the tool I like most, which is diaphragmatic breathing, because you can always change your breathing no matter where you are, and steps you through the process of how do you start to change fears, both first with the thinking and then with the action. If you're a therapist, whoops, sorry. if you're a therapist, there are good books written. There's Dr. Brenda Wiederhold has written a book for therapists as well as a book for clients. I've written a book for therapists that, again, tries to take you through step by step. I really wanted to be one clinician talking to another. What do you actually do if you have someone with this anxiety disorder or that anxiety disorder, and how does VR fit into it, and how do you prepare, and then how do you use VR? So I think looking for books, looking for trainings, where you've got as one clinician, you're listening to another explain to you, this is how I do it, step by step by step. There's a 6-hour course that I gave, a webinar that's recorded, and that's on PESI, PESI, PESI.com as well. And there's a website, svrt.org, Society for Virtual Reality Therapy, svrt.org, that has information for therapists, for clinicians. And there's a free video, where I basically hired an actress, and we did a video of how to treat needle phobia, that includes using virtual reality for the exposure piece.
Adam and I were just talking about that recently.
Yes.
Using VR.
That's what I thought.
Oh, sorry. I am trying to turn off my phone.
Siri agrees with us too.
Yes, absolutely. Siri agrees with us.
Oh, now I set her and activated on my phone too. We're just going to all have a Siri conversation.
Something talking about like needle phobia. Something I hear from clients often is they want to try VR therapy, but they're concerned because it makes them sick, or they don't see the point because we're not actually sticking them with a needle. And so my question, what Jessica was talking about, was, is there a tool out there for this particular fear? And so a lot of research was kind of put out there, and I'm a big research person, so I love reading, just kind of seeing what's out there. What do you say to clients, or maybe suggest clinicians say to clients when clients are interested in this, but there is that kind of fear of like, every time I've worn it, I get seasick or motion sickness. Motion sickness. So I don't know if it would work for me.
Well, it doesn't work for everybody, but I have to say, during the pandemic, when the vaccine was new and was required, I had a lot of people that I treated for needle phobia, and in general, they were over it in about 3 sessions average. Now, if when you put on the headset, you instantly have nausea, you may not be, VR may not be for you. But I've only run into one person where that was the case. Occasionally I've had people where we had to have shorter experiences using the headset. It may also be that it may be that these clients have been using VR for gaming, where there's it's far more intense. It's far more, you're moving here and there, and things are jumping out at you, and that's not the kind of VR that we're using for therapy. And they need to understand that this is a very different experience, and they may not have the same nausea response. If they, so again, I've had so few patients. I'm trying to remember. I'm not sure there's anybody who has used the VR that's available for therapy, designed specifically for therapy, who has become nauseous. There was one person at a talk who couldn't put it on. So I think the fear of that is far greater than the actual incidence. Okay. And for treating needle phobia, I often add, if they're in the session with me, if they're physically with their permission, I add some kinesthetic parts to the visual and the auditory. So as the nurse comes close to them and talks about putting on the tourniquet, I will squeeze, squeeze their hand like a tourniquet. And then when they do the blood draw, I'll take a pen or a pencil and just give the kinesthetic sense of the needle going on, or for an injection, the kinesthetic sense. And even with teletherapy, I would just say to them, all right, now while you're in VR, before we do that, I want you to pick up the pen, and when you get the injection, feel the needle going in, and have them, create some of the kinesthetic, add some of the kinesthetic experiences. Now, again, the more focused the fear is, the more quickly the use of VR can be effective. The more complex, if you're dealing not only with a fear of needles, but that the fear of needles is part of a fear of giving over control to anyone, a greater, deeper sense that no one can be trusted and that they are vulnerable because of perhaps childhood multiple experiences in which they were vulnerable, in which they were mistreated, in which others were not to be trusted, then of course you're dealing with deeper issues.
Mm-hmm. And that's
But I have to say, during that period of time where people had to get vaccinated, there was that necessity, right? And when someone feels, I have to get over this, I have to do this now, then again, that contributes to successful treatment.
Yeah. I was going to say that's part of knowing, like if there's something deeper, that's part of knowing your client and properly pairing the treatment with what is needed and then what comes up along the way to what gets elicited. One of the things that you were saying in say like a telehealth session where you're having the person, pick up the pen and at the time, or even in person, it made me think of that process of pairing and the embodiment, the immersion, and the pairing of the physical sensations, and instantly I thought of the rubber hand experiment,
Uh-huh. Right.
and so anybody can look that up on YouTube, and there are videos about it. But essentially pairing visual when someone's stimulating a rubber hand and simulating their own hand that is out of their vision area, then pretending that you're going to hit it with a hammer, and people freaking out because they've paired the tactile with the visual and now are worried that they're actually going to get hurt because there's been a combining, a pairing in their brain of these things that equals ownership of this rubber hand, right? And so I think that's an illustration that a lot of people could just go watch and then start to combine that with the things that you were just saying in the process of the treatment that then helps people, I think, to understand further how that can be so powerful.
Exactly.
And the importance of each piece.
Yes. If I And VR can also be used to go back to put yourself back in situations where perhaps there was a traumatic experience
Mm-hmm.
and begin to process that and overcome that. If I write it down, that can be helpful and powerful, but there's that distance between what I've written. If I imagine it, some people are more able to visualize than others, and the capacity to create a vivid image declines as we age. We know that. And you don't necessarily control what you imagine, and certainly the therapist doesn't control it. VR overcomes all of those limits.
Mm-hmm.
Yeah, with VR, you're there, and the therapist can control where you're there, and you can tell the therapist where you are and what you're thinking and what you're feeling. So the therapist is kind of there in your head, which is where you want the therapist to be, right? You want that voice to be your own voice over time. You want to change what you tell yourself. And the two of you collaboratively
Mm-hmm.
are putting you in a place that feels real. Yeah.
And as you were saying, some clients would have some difficulty with the imagining. Some clients have a very powerful and amazing ability in the imagining. Either way, the communication of that imagining, it's like a game of telephone. You're going to miss some things are going to get lost.
Yeah.
Between the person trying to change what they're seeing visually, imaginatively in their head, now changing that into something verbal.
Right.
Going to come out verbally. The therapist is going to hear it auditorily. Now it has to be transformed into something visual, right? Whereas in virtual reality, particularly if it's either a multiplayer environment where both the therapist and the client are in headsets, or something where it's casted, so the therapist can see the view of the client. Now you don't have the game of telephone happening. You're seeing it, they're seeing it. If it's yours is on a 2D screen and theirs is in 3D, okay, there's some variation there for sure. But
You see what they see, you hear what they hear, you know what their experience is.
yes.
Yes. And then together you can talk through it. So if you think about the tools we've had for getting over fears, right? It's been writing or talking, imaginal exposure, right? Or it's been what's called in vivo exposure, doing it in reality.
Mm-hmm.
Well, this overcomes the limitations. Reality, we don't control it. Either they're by themselves or else they're paying to have you with them, which also has problems. It's right. You still don't control the reality, and you can actually, your presence can become a safety action, which interferes with getting over the fear. Writing or imagining, it's easy to do, it's personalized, but again, right, there's that lack, that communication gap. VR just overcomes all of those disadvantages and has all of the power and advantages of evidence-based exposure. So yeah, what can I say? It's a wonderful tool.
And I love how it comes back to knowing your client, knowing the environment, and so being able to see it. When you're both being able to see it, you're not having to interpret. Like, you're there, you're knowing, as the clinician, you're knowing, seeing what they're seeing. What's your, as we kind of come to the end here, I'm curious what your hope is for the future of this this tool in this field.
My hope is that podcasts like this will reach mental health clinicians who will become excited about the possibilities, who will understand that VR does work, that it's not hard to learn. The tools really are pretty intuitive. that if they want guidance, there are, there are books and courses out there to give them guidance. And if they're worried about the cost, which I understand is an obstacle, I'm hoping that over time the cost goes down. But even now, you want to balance the cost versus the benefit to your clients, the benefit to your practice. It's going to bring you motivated and happier clients, and referrals from other clinicians. I'm hoping that more VR tools will be created that are usable with remote teletherapy, that give therapists more and more control and ability to individualize the experience. And that over time, cost will decrease. So
Call out to therapists there, call out to developers there, call out to clients there.
Yeah. So
Great. Well, thank you so much for joining us today. If people want to learn more about you or about your work, how do they find you?
Well, they can go to my website, which is fairly straightforward. It's Elizabeth-McMahon.com. And the books are available on Amazon, both the therapist book, Virtual Reality Therapy for Anxiety, a guide for therapists, and the client self-help book, Overcoming Anxiety and Panic, interactive guide.
And through Rutledge, right?
And through Rutledge, yes.
And sometimes they have sales, so I always look at both.
That's true. Absolutely. Yes. The therapist guide you can look at through Rutledge, and as you say, look for those sales. And if you're a therapist looking for training, check out Pessy.com for their sales.
Mm-hmm.
Yeah,
because you said you have the 6 hour there through them as
I
well.
do. Yes.
And I would put out there, I hope it's okay with you, I would also put out there to follow you on LinkedIn, because you often will put if you have an interview or if you have an event coming up, so they can find out where you are and what you're doing through that as well.
Yes, indeed. And, just a shout out to the book that you're editing about mental health and VR uses. And I will be down in Long Beach with Drs. Howard Gurr, Joe Elliott, and Dr. Skip Rizzo on a panel.
Yep,
So
that's fantastic.
Yeah. It's the AWE Augmented World Expo.
That's awesome. Yeah, it's a great conference. I went a couple of years ago. I haven't been recently, but yeah, it's a great conference. I'm glad you're going to be there and hopefully reach even more people.
And if anybody's there, please find me. I'll arrive the day before, and we'll be speaking toward the end of the first day. That's June 18th in Long Beach, California.
Awesome.
Great.
I really have enjoyed talking with you today. I always enjoy talking with you. Your chapter in the book that you gave the shout out to is fantastic, of course. And there'll be another great resource for people to find out ways that they can use the book. So thank you so much for writing, contributing to that. And I'm excited also that you were our very first participant in our brand new podcast. So thank you for doing that as well.
Oh, that's great. It's an honor to initiate it. And I'm delighted that you guys are doing this. We're going to reach out more and more people.
Absolutely.
Yeah.
I agree. Thank you so much.
Thank you, Adam. We'll see you next time.
So I will link your information, or we'll link the information when the podcast goes up for everybody to find. And Join us next time on Reality Bites. This episode was brought to you by MHVR in partnership with the American Medical Extended Reality Association.